Autism is a neurological disorder that is characterized by difficulties with social interaction, communication, and repetitive behaviors. It is also known as autism spectrum disorder, ASD, due to the wide range of symptoms and severity that can occur in individuals with autism. The World Health Organization, WHO, defines autism as a neurodevelopmental disorder that affects social communication and behavior. Autism affects about 1 in 100 children globally. However, the prevalence of autism varies across different regions and countries, and it is estimated that the actual number of people affected by autism may be higher. Autism is more common in boys than in girls, with a ratio of 4 to 1. Symptoms of autism may be detected in early childhood, but autism is often not diagnosed until much later. Early signs of autism may include delayed speech development, lack of social interaction, and repetitive behaviors. However, some children with autism may develop normally for the first few years of life and then experience a regression of skills. The abilities and needs of individuals with autism vary and can evolve over time. While some people with autism can live independently, others have severe disabilities and require lifelong care and support. Autism often has an impact on education and employment opportunities. In addition, the demands on families providing care and support can be significant. Societal attitudes and the level of support provided by local and national authorities are important factors determining the quality of life of people with autism. Autism is a complex disorder that is caused by a combination of genetic and environmental factors. The exact cause of autism is still not fully understood, but it is believed to be the result of the interaction between genetic vulnerability and environmental factors such as prenatal infections, exposure to environmental toxins, and nutritional deficiencies during pregnancy. Research has also shown that there is no evidence of a causal association between the measles, mumps, and rubella vaccine, and autism. Previous studies suggesting a causal link were found to be filled with methodological flaws. There is also no evidence to suggest that any other childhood vaccine may increase the risk of autism. There is no cure for autism, but early diagnosis and intervention can improve outcomes for individuals with autism. A broad range of interventions, from early childhood and across the lifespan, can optimize the development, health, well-being, and quality of life of individuals with autism. Timely access to evidence-based psychosocial interventions can improve the ability of individuals with autism to communicate effectively and interact socially. The monitoring of child development as part of routine maternal and child health care is recommended. It is important that, once autism has been diagnosed, individuals with autism and their caregivers are offered relevant information, services, referrals, and practical support, in accordance with their individual and evolving needs and preferences. The health care needs of individuals with autism are complex and require a range of integrated services that include health promotion, care, and rehabilitation. Collaboration between the health sector and other sectors, particularly education, employment, and social care, is important. Interventions for individuals with autism and other developmental disabilities need to be designed and delivered with the participation of people living with these conditions. Care needs to be accompanied by actions at community and societal levels for greater accessibility, inclusivity, and support. All people, including people with autism, have the right to the enjoyment of the highest attainable standard of physical and mental health. Autistic individuals are often subject to stigma and discrimination, including unjust deprivation of health care, education, and opportunities to engage and participate in their communities. People with autism have the same health problems as the general population. However, they may, in addition, have specific health care needs related to autism or other co-occurring conditions. They may be more vulnerable to developing chronic non-communicable conditions because of behavioral risk factors such as physical inactivity and poor dietary preferences.